Welcome to Fallout Funds. I know I'm a silver and gold channel, but this is much too important not to talk about. People are dying. I've had friends and family struggle and die from addiction. If you or someone you know is using and ready to get clean, please encourage them to call the Emergency Substance Abuse Hotline for treatment and referrals. The number is 1-800-662-HELP or 1-800-662-4357. First, what is Suboxone and how does it work? Suboxone, a combination medication containing buprenorphine and naloxone, is one of the main medications used to treat opioid addiction. Using medications for opioid use disorder is known as MOD. Use of MOD has been shown to lower the risk of fatal overdoses by approximately 50%. It also reduces the risk of non-fatal overdoses, which are traumatic and medically dangerous. Suboxone works by tightly binding to the same receptors in the brain as other opiates such as heroin, morphine, and oxycodone. By doing so, it blunts intoxication with these other drugs, prevents cravings, and allows many people to transition back from a life of addiction to a life of normalcy and safety. Unfortunately, within the addiction community and among the public at large, certain myths about Suboxone persist, and these myths add a further barrier to treatment for people suffering from opiate addiction. Myth 1. You aren't really in recovery if you're on Suboxone. As addiction is increasingly viewed as a medical condition, Suboxone is viewed as a medication for a chronic condition, similar to a person with type 1 diabetes needing to take insulin. To say that you aren't really in recovery if you are on Suboxone is stigmatizing to people who take Suboxone, and it's not the medical reality of effective addiction treatment. Myth 2. People frequently misuse Suboxone. Reality. Suboxone, like any opiate and many other medications, can be misused. However, because it is only a partial agonist of the main opiate receptor, the mu receptor, it causes much less euphoria than the other opiates such as heroin and oxycodone. In many cases, people may use Suboxone, or misuse it, if that is defined as using it illegally, to help themselves manage their withdrawal, or even to get themselves off heroin or fentanyl. If Suboxone were more available to those who need it, they wouldn't have to self-treat. We are, in effect, blaming the victims here. Myth 3. It's as easy to overdose on Suboxone as it is to overdose with other opiates. Reality. It is extremely difficult to overdose on Suboxone alone. It is much more difficult to overdose on Suboxone compared to other opiates, because Suboxone is only a partial opiate receptor agonist, so there is a built-in ceiling effect. This means there is a limit to how much the opioid receptors can be activated by Suboxone, so there isn't as great a risk of slowed breathing compared with potent opiates such as heroin, oxycodone, or morphine. When people do overdose on Suboxone, it is almost always because they are mixing it with sedatives such as benzodiazepines, medicines that also slow breathing. Myth 4. Suboxone isn't treatment for addiction if you aren't getting therapy along with it. Reality. Ideally, addiction treatment should include mood as well as therapy, recovery coaching, support groups, housing assistance, and employment support. But that doesn't mean that one component, in the absence of all of the others, doesn't constitute valid treatment for addiction. Currently, about 10 to 20% of people with opioid use disorder are getting anything that qualifies as adequate treatment for their disease, due to flaws in our healthcare system and shortages in qualified providers. So, while combination treatment is an admirable goal, it is unrealistic to expect that everyone with an addiction will receive all the aspects of treatment that they need, especially if you add in that many people who suffer from addiction often also lack access to regular health care and health insurance. Further, treatment with Suboxone alone, without therapy, has been proven to be effective. But it can be even more effective if combined with additional supports, such as therapy, recovery coaching, etc. Myth 5. Suboxone should only be taken for a short period of time. Reality. Expert practitioners have different theories on how long Suboxone treatment should last for. But there is no evidence to support the claim that Suboxone should be taken for a short period of time as opposed to being maintained on it for the long term, just as a person would manage their diabetes with insulin for the long term. Ultimately, this comes down to patient preference. One of the main obstacles to getting life-saving treatment for addiction is the stigma people face. Fortunately, our society's perception is slowly starting to transform away from an outdated view of addiction as a moral failing toward a more realistic, humane view of addiction as a complex disease that needs to be addressed with compassion, as well as modern medical care. Eliminating myths and misinformation about addiction and supplanting them with up-to-date, evidence-based treatments is a critical step in the evolution and improvement of addiction treatment. You have nothing to be ashamed of. Treatment is you taking back control of your life, the control that was taken away from you. If you're still watching this, I'm proud of you, because you obviously have interest in getting clean, and perhaps you're ready. I'm doing it, and you can too. You got this. Together we stand, divided we fall. Thanks for watching. Don't forget to like and subscribe. Good luck and God bless you.